this task about 2 years ago when I got together with Bill Cassidy, who is a very conservative Republican senator from the Deep South. If you listen to Bill Cassidy talk about anything other than mental health, you realize that he and I don't agree on much of anything other than the fact that this system is very broken and we need to fix it. We decided to get together and do something that hadn't been done in a long time, which was build a piece of legislation that wasn't just a fix of this corner of the system or that sector of the system, but to try to survey, both in Louisiana and Connecticut, across the nation, all the things that we needed to do better and to try to present a comprehensive reform of our mental health system. And we went out and built an amazing coalition, including Paul Gianfrido's organization and many national organizations that you belong to. Anybody that works on mental health is an endorser of our legislation. We went out and built a diverse coalition of legislators. We have 16 co-sponsors, 8 Democrats and 8 Republicans, equal numbers on both sides, representing a real cross-section of both caucuses. And we got the bill introduced and passed through the committee that we sit on, the Health and Education Committee. The bill, though, is really a product of about a dozen meetings like this that we had all over the state of Connecticut. And I won't go into the details on the bill, but at its essence, it's really centered around 3 things that we heard over and over again when we did our forums in Louisiana and Connecticut. First is the obvious one: resources, right? You just can't operate this system on the money that exists today and the lack of provider capacity that exists across the country. And it just can't work. It just can't work on the reimbursement rates that exist and the lack of access that exists. And so in our bill, there's a number of pretty expensive plus-ups in funding for both inpatient care and outpatient care. And again, we got a lot of Republicans supporting big new investments in mental health. Second is a doubling down on coordination. Mark's been ahead of the curve on this, and a lot of people in this room have been ahead of the curve on this, but we still have a pretty ridiculously siloed healthcare system in which, as a result of the community mental health system being built in the 1960s, we've got the healthcare system for every part of your body other than the brain over here, and then the healthcare system for your brain over here. And we're getting better at bringing them together, but there's still all sorts of reasons why it doesn't make sense to bring them together, from the regulatory systems to the reimbursement systems, to the way in which insurers deal with these things. Our bill, in a variety of ways, would bring the 2 systems together and encourage funders and regulators to do the same. And then lastly, we should be really proud of the Mental Health Parity Act, which says that if you've got insurance, you've got to have a benefit that treats mental illness and mental illness coverage the same way as physical illness coverage.